In name of God, the most compassionate, the most merciful, this is Hossein Akbari. I'm talking User Miniature Talk 7 2021. My presentation is about double-edged sword of the dark web, its implication for medicine and also society. As for every presentation, I should declare my potential conflict of interest, and I declare I have no conflict of interest in this presentation. I showed it in a barcode as we're talking about the dark web. Okay. Concerning the dark web, did you know you can order a negative COVID-19 result, a certification of COVID-19 vaccination, or 2 doses of COVID-19 vaccines in dark web? Average for each dose is around $500. Okay, let's have a quick review on the subjects. In this presentation, I briefly mentioned what is the dark web, the potential disadvantages, also advantages. So, what's the dark web? What we already know about internet or interconnected network is what is this about the sea level. As you see, we have surface web and deep web. Surface web is, we already knew the Google. But interesting point is that when you're Googling, you have only access to 4% of the internet. Yes, 4%. So deep web is, we know with the places we need to have to access with username as password, like corporate emails, digital paywalls, and cloud hosting services. But below the ice, below the sea level, you can see a place of the iceberg that called dark web, or darker portion of the deep web. It requires specific softwares, configurations, or authorization to access. So what makes this place very interesting for us is two features. The first one is data on person are anonymous. And the second one, commerce take place by cryptocurrencies like Bitcoin. Yeah, for many years, Bitcoin was the currency in the dark web and crypto markets. Okay, these two features make this place a very, very nice place for illicit transactions, such as trade of private medical information, illicit drugs, weapons, as well as organ trafficking and human trafficking. Let's start with the organ transplantation. It is estimated that crypto market covers 5 to 10% of kidney markets transplant. You know that around 20% of United States population every year received their transplantation, because around 100,000 of them needs transplantation and only 20,000 of them can receive this. So richer people may divert the direction and look for alternative solutions like cryptocurrencies and crypto market and the dark web. So 5% to 10% is not a awkward numbers. You can see the transplantable organs and their prices in different countries. So it is responsibility of all physicians and global health workers to warn, to make their patient knowledgeable about the dark web advertisement and their hazards, because it requires pre-operative care, both pre-operation and post-operation care. It's a really heavy surgery. Okay, trade of illicit drugs. You can also buy everything from benzodiazepine to cocaine, and it could be delivered to your place with the dark web, a high quality one. Interesting to know, the first online drug exchange occurred in 1971. Yes, 1971, using ARPANET, the internet at that time, between Stanford University student and MIT students. The point here is that Silk Road, as a reputable site in the dark web, had a $1.2 billion turnover in 2 years. And the point is, because people are anonymous, I suggest healthcare workers and addiction psychiatrists can participate in forums like NA forums, Narcotics Anonymous forums, and warn them and help people how to quit drugs and proper dosing. The third one is data trade. Interesting to know, in 2016, hackers stole 16 million American records of healthcare organization. So it would be really vital to know that hacking personal genomic data in future could threaten the whole population, as whole genome sequences become prevalent for diagnosis of many diseases. So if this data could be stolen and sold in the dark web, like what occurred in 2016, and they sold every document between $20 to $50. The terrorists and governments could design virus bombs and destroy a nation, a race, and they could do almost everything. So I suggest here to maximize patient medical information data security in digital era. But still, there are advantages. I've already talked about virtual narcotic anonymous research in third world. As research budget in third world is so meager, I personally suggest that books and literature could be obtained from the dark web. Those countries under sanction can buy almost everything for their population. And also, the main point here is the whistleblowers who are talking about corruption in health system, and their anonymity make an opportunity to mention the corruption as while they are safety, they can send their proof. This is my end of presentation. This is the link of my paper in Journal of American Society of Internal Medicine, and this is a quote from Jamie Bartlett. Thank you very much.